Mr. Speaker, I rise today to address a critical issue that continues to impact the health and well-being of our people, namely the rising burden of non-communicable diseases, or NCDs, such as heart disease, diabetes, cancer, and respiratory illnesses. These diseases account for the majority of deaths and healthcare costs in Bermuda, yet many of them are preventable by addressing key risk factors. Mr. Speaker, reducing the prevalence of NCDs requires a comprehensive and sustained approach focused on prevention, early intervention, and policy measures that create an environment where healthy choices are the easiest choices. It is worth emphasizing that our government remains committed to tackling the key risk factors that contribute to these diseases, including unhealthy diets, physical inactivity, and tobacco use. Promoting healthy nutrition. Mr. Speaker, unhealthy diets, particularly those high in sugar, salt, and trans fats, contribute significantly to obesity, diabetes, and cardiovascular diseases. As part of our ongoing efforts, the government will introduce legislation during this session aimed at banning industrially produced trans fats in food products to promote healthier diets and reduce the risk associated with heart disease, stroke, and diabetes. Trans fats, which are often found in processed and fried foods, pose significant health risks whilst offering no health benefits. High consumption of trans fats significantly increases health risk, raising the likelihood of death from any cause by 34%, coronary heart disease deaths by 28%, and coronary heart disease overall by 21%. The Grow, Eat, Save program. Mr. Speaker, we continue to promote local and healthy food options through Grow, Eat, Save program, the government initiative aimed at promoting food sustainability, healthier eating, and community engagement in agriculture. This program encourages residents to grow their own fruits and vegetables, reducing reliance on imported foods while fostering a greater appreciation for nutrition and self-sufficiency. The key goals, Mr. Speaker, of the Grow, Eat, Save program include: 1. Empowering residents, teaching Bermudians how to grow their own food through workshops and hands-on training. 2. Promoting healthier eating, encouraging the consumption of fresh, locally grown produce to combat diet-related NCDs like diabetes and obesity. 3. Reducing food costs, helping families to save more money by growing their own fruits and vegetables rather than relying on the expensive imported goods. And 4. Strengthening food security by enhancing Bermuda's ability to produce its own food and become less dependent on external food sources. Mr. Speaker, Bermuda imports the majority of its food, which can be expensive and subject to global supply chain disruptions. Encouraging home and community gardening through the Grow, Eat, Save program helps to reduce food costs, improves nutrition, and strengthens locals' resilience against external economic pressures. Bermuda Healthy School Lunch Competition. Mr. Speaker, another exciting initiative I would like to highlight is the Bermuda Healthy School Lunch Competition, which is aimed at promoting healthy eating habits amongst our students whilst encouraging creativity in preparing nutritious meals. The competition, launched as part of the government's broader efforts to combat child obesity and NCDs, challenges students, parents, and schools to develop balanced, delicious, and affordable school lunches that meet national nutrition guidelines. Mr. Speaker, this initiative not only fosters better eating habits, but also raises awareness about the link between nutrition, academic performance, and long-term health. By making healthy eating fun and engaging, Bermuda is taking proactive steps to shape a healthier future for the next generation. Encouraging physical activity. Mr. Speaker, a sedentary lifestyle is a major risk factor for NCDs, and we must do more to integrate physical activity into daily life. To achieve this, the government has implemented several initiatives to promote physical activity and healthier lifestyles, recognizing its crucial role in preventing NCDs such as obesity, diabetes, and heart disease. These efforts include investment in public fitness infrastructure, policy initiatives, and community programs. Mr. Speaker, outdoor gym equipment in parks. That's number 1. The government has installed outdoor gym equipment in public parks and in recreational areas to provide free and accessible exercise options for residents of all ages. 2, tax concessions for gyms and fitness facilities. To support the fitness industry and encourage more people to join gyms, the government has provided tax concessions to help reduce operational costs for gym owners and fitness centers. This measure aims to make gym membership more affordable and accessible to a broader segment of the population. 3, community-based exercise and wellness programs. Programs like the Move More Bermuda and workplace wellness initiatives encourage the community to incorporate physical activity into their daily routines, promoting healthier lifestyles and combating sedentary behavior. A notable event under the initiative is the Move More Bermuda Senior Games, which is targeting individuals aged 50 and above. The 2024 Senior Games took place on the 19th of May at the Flora Duffy Stadium, offering participants a range of track and field events, including the 600-meter dash, the 3,000-meter run, long jump, shot put, and mixed 4x4 relay. This event emphasized friendly competition and community engagement, aligning with the broader goals of the Move More Bermuda campaign. Addressing tobacco and vaping use. Mr. Speaker, smoking and vaping remain major contributors to respiratory diseases, cancers, and cardiovascular issues. To combat this, the government will advance restrictions on flavored vaping products to protect public health, especially among young people. Flavored vaping products often come in sweet, candy-like, or fruity flavors that appeal to younger demographics, making them more likely to experiment with vaping. And this, of course, can lead to nicotine addiction at an early age, exposing them to long-term health risks and potentially acting as a gateway to traditional nicotine and tobacco products. Mr. Speaker, by limiting access to such products, we aim to reduce the appeal of vaping for young people, curb the rising rates of nicotine dependence, and prevent related health issues. Furthermore, Mr. Speaker, these restrictions send a broader public health message emphasizing the importance of safeguarding future generations from the harmful effects of addictive substances. Mr. Speaker, prevention is undeniably the most cost-effective strategy to reduce the burden of NCDs and secure a healthier future for Bermuda. However, we cannot do this alone. It requires a whole-of-government and whole-of-society approach, one where individuals, businesses, and community organizations work together to foster a culture of health and wellness. The government remains firmly committed to implementing evidence-based policies and initiatives to combat non-communicable diseases. By prioritizing prevention, education, and healthier environments, we will improve the quality of life for all Bermudians while also reducing the financial strain on our healthcare system. Thank you, Mr. Speaker.